Hello, ladies and gentlemen. Thank you very much for joining me in this live class on how to treat chronic skin conditions, particularly eczema and psoriasis. Now, I've spoke before on different skin conditions according to Ayurveda, and I'll review that subject. And I've spoke before on allergies and allergy skin conditions. I've spoke before on acne, but today we're going to focus more on, more advanced inflammatory skin conditions that are inflamed, red, and definitely chronic and difficult to treat. However, I've been very successful at treating a wide range of health issues as well as eczema and psoriasis. And today I'm going to share my knowledge of the causes, the dietary requirements, and the herbal remedies necessary to reverse these conditions. My name's Khabir Southwick, registered Ayurvedic doctor, registered Ayurvedic pharmacist, master herbalist, they say, and the founder of herbalist.com, the sponsor of today's class, herbalist.com. So, from the Ayurvedic perspective, these skin conditions, different types of dermatitis, are viewed and diagnosed and treated, of course, very differently than Western medicine. In Western medicine, there's many types of dermatitis, many skin conditions I've treated where I've never heard of that skin condition, and even rare skin conditions I've treated successfully. That's because we don't go by the medical label that is given. We go by the signs and the symptoms and the doshic imbalance that is involved. So just to summarize the Ayurvedic perspective on skin conditions, or really all skin conditions, there's generally there has to be like ama involved in most cases. Ama is toxins. So we could just say there's got to be toxins. We know the skin, the largest organ, the largest eliminating organ, eliminating toxins 24/7. Just like we exhale, we're our breath, we're also eliminating toxins. Carbon monoxide is a toxin for the body. And, we urinate out toxins, uric acid and other toxins. And we defecate out toxins, but we're also sweating out toxins. And one of the major causes of many skin conditions is the toxins in the blood that are emitting and sweating out through the skin tissue. And then there's a reaction on the skin. Now, and all skin conditions can be classified as either pitta imbalance, vata imbalance, or kapha imbalance, or a combination. So let me explain. If it's a kapha skin condition, their skin's going to be oily, and usually there's acne and pus and whiteheads. So that's not what we're talking about today, but that is a type of skin condition where there's pus or even infection. And the skin tends to not be that dry, but oily. And there's skin fungus, for example, is in that category. And then there's, vata skin conditions, or dominant vata, where it's extremely dry. Eczema leans more in that direction, but it's not all that cut and dry. Dry, flaky skin conditions without red, burning, heat, or inflammation, but very dry and flaky. That would be a type of vata skin condition, because that's the qualities of vata: dry, light, cold, and hard. And now the third type, which is more along the lines of what we're going to talk about today, is a pitta type of skin condition. Pitta, of course, has always evident by heat and even burning sensation. So it's and redness, red, hot, burning, inflamed skin conditions. This would be the type that we're going to focus on today. So sometimes the doctor will call, like if it's psoriasis, generally that we can conclude that it's in this pitta category. This is the immune system over responding, creating the reaction. And then there's redness, red patches, and there's inflammation and burning sensation and heat. And vata, and it can be also pitta vata with dryness and flaky and itchy as well. So, it's this combination of dry, heat, itchy, red, not red, which is used to diagnose the conditions because Ayurveda is an ancient system. So going by the signs and symptoms was their methodology for classifying the skin condition. And of course, whether there was ama toxins or no ama, and which doshas were involved, vata, pitta, and kapha. This is the way it's classified in Ayurveda. But we can say that most skin conditions, particularly the inflammatory skin conditions, dermatitis, inflammation of the skin, where there's redness, rashes, little red spots or hives, or are just heat, burning, with or without itching, this is all involving the pitta dosha, the heat. So there's this, kind of redness and inflammation. As inflammation is, dominated to a large degree by pitta. And so that means if we look at the dietary changes, which are generally for the type we're talking about today, this inflammatory red type of skin condition, I can show you some pictures in a minute of the type of skin condition we're talking about. Here's the dietary changes that would be necessary. No tomatoes, nightshades, bell pepper, and hot spices. These will be the first things that are removed from the diet. Anything actually too heating, even too much black pepper. I've seen people with bad rosacea, for example, which is a mild inflammatory skin condition where there's just redness on the face. It's not PASI, it's not psoriasis, it's not eczema. They just call it rosacea, but it's a mild case in this case of what we're talking about. And I've had people who just stopped having garlic and it improved. And that's according to Ayurveda. If you have this red, that's pitta. If you have heat and you touch it, it's hot. Like when the patients come to my clinic, I touch the skin condition and I touch their forehead and then I touch where the skin condition is and I can feel the heat. So this is inflamed. Inflammation always produces heat and often swelling, not necessarily pain, but heat for sure. So I can feel the heat and then I know it's pitta. And then once I feel that heat, then I say no hot foods, no chili pepper, no black pepper, no cayenne pepper, no garlic, no raw onions, and no nightshades, tomatoes, eggplant, bell pepper. Now, of course, modern science is finally catching up with Western medicine and starting to understand the inflammatory qualities of the nightshades. Now they've identified them as lectins, and so science is caught up. I would never tell anybody to follow the science because science is always the last group of people to understand a health issue. I mean, ancient people can know about how to treat something and maybe not be able to explain why. We can call this like empirical knowledge, means this is what they always did when they had this health issue and it went away. They don't always know why. They can't explain it scientifically, but they know it works. And, Ayurveda is somewhat like that. It doesn't have the scientific backing, but there is an Ayurvedic explanation to why you have the condition. It's just that your layman may not understand it. And many people, like in India, who follow Ayurveda are sometimes doing things without the knowledge even of Ayurveda to solve their health issues. So that's why science is valuable. They just have to prove it. It's more of a linear left brain type of thinking that needs evidence. So, if you've got a problem and you take some herb and it fixes it, you don't really care about the evidence or what the science thinks. It's irrelevant. So here we have a perfect case of this to prove my point, is that Ayurveda has been saying for thousands of years that the nightshades are inflammatory. And now science has come to the conclusion that it's actually the skin and the seeds that have lectins in it, which is kind of a phytonutrient. And this is inflammatory. In fact, I've even had patients who told me their doctors, mostly on the West Coast, where they're a little bit more progressive, let's say, the doctors themselves have told the patients with arthritis to not have nightshades. This has only happened in the last year of my 27 years of practice. So the information is slowly getting over to the medical world about things that Ayurveda knew for centuries, if not thousands of years. I digress. So let's go back to the diet. So these hot, spicy foods. Now, if you have if there's heat, a hot, spicy food generally needs to go out in almost all skin conditions. The skin, like the eyes and the kidneys, are very sensitive to hot spices. So generally, these hot spices go in most cases, unless you're maybe the kapha type and you have oily skin and pimples. Maybe it wouldn't be a big factor there. You'd be more concerned about the fat, the oil in the diet. Usually it's these young, teenagers and 20-year-olds who get the pimples. It's coming from the trans fats and the hamburgers and the hot dogs and the fast food. I will also say that, constipation can be a factor. And those people who are even slightly constipated, like one bowel movement a day or just missing a bowel movement once a day, will always benefit from taking colon herbs. So all patients that I treat for skin condition, for example, if they're not having like 3 bowel movements a day, I'll always throw in a colon formula or colon tea as well. And I've had many people who had just had acne and said, as long as I take the colon formula, I don't get the acne. So there's definitely, that's the connection between the toxins. What the naturopath says is, when you're not having regular bowel movements, you create what's called autotoxicity. It reabsorbs back into your bloodstream. And so you have to keep these bowels moving quite good to keep your skin good. Even if you don't have a skin condition, you need to keep your bowels moving. In fact, many women have told me, not only is my digestion better, not only is my constipation better, but my skin improved. Well, see, there's a big connection there. A person who is constipated for a long time, you give them certain herbs to clear the constipation and clean the colon, and then the skin gets better. Even people who didn't have constipation, they were just taking a lot of my herbs maybe for another condition, but because these herbs really have a lot of value more than just what they're labeled to do. Many people said, well, not only does my blood pressure better, but I feel better than I've ever felt in my life, and my skin complexion totally improved. And that was because maybe the health condition they had was also due to toxins in the blood or the liver, and the herbs cleaned it out, and then the skin, as a result, got better. So this can never be ignored when it comes to looking and diagnosing skin conditions. Is the digestion and the elimination, both two separate subjects. But back to the diet. Now, if you have, that's pitta. Pitta's for the spicy. If there's hot and burning, all this hot foods, even ginger, even turmeric has to go. Turmeric is related to ginger. People think it's a cure-all, but it's not. And it can be heating, particularly if you take too much. It depends on how inflamed or red your skin is. But if you're getting really bad rosacea, you don't even want to take turmeric. You want to take cooling herbs like fennel and coconut water and cooling things, okay? Now, if there's a lot of dryness, you could have heat and dryness, like burning hot plus flaky and dry, and just like dry, hard patches. If there's just dry, hard patches without the heat and burning, then you're just focusing on the vata. If there's heat and burning plus dry, hard patches, this is 2 doses of pitta and vata. So to balance the vata, generally there has to be more oil in the diet. Oil in the diet. And of course, the best oil is ghee. Ghee is the best. It's the cooling oil. You can't do hot oils like mustard oil or too much sesame oil if you have, a red inflamed skin condition. You have to do cooling oils, coconut oil or ghee. And a lot of people are still a little low on fat. It's easy to be low on fat if you're not having much animal protein, or if you're having liver problems and you're not able to digest the fat. So there's many reasons people can be low on fat, and this can be detrimental to the skin. Signs of low fat are dry stool, hard dry stools. This is a sign. Dry of skin can be another sign of low fat diet. Cracking joints. That means you're not consuming, there's not enough cartilage between the joints, and part of that could be, it's kind of a state of depletion, and part of the depletion could be the lack of oil, fat in the diet. So generally, if you have dry skin, you want to up the oil and stop all dry things. No crackers, no nuts, everybody in North America seems to be snacking on nuts. I don't know where they got it. Must have got it from social media or some YouTube person promoting nuts. I don't know what happened. It was kind of like chocolate. Everybody was doing chocolate, thinking that's a superfood. And by the way, you have to remove chocolate if you have any skin problem as well. Not only because of the sugar, but because the chocolate bean, which is really not a bean, but anyway, it's inflammatory. And people think it's healthy because it had magnesium. Great marketing to convince an entire society, an entire continent that something that's been known to be inflammatory for thousands of years, cacao bean, that it's healthy because it has magnesium. So chocolate has to go. And if you're too dry, then things that are drying, crackers, nuts, chips, and coffee. Coffee is a strong diuretic and it'll just dry you right out. So you at least got to go over to green tea. And green tea is anti-inflammatory. Well, coffee is inflammatory. So, it's definitely worth making the move from inflammatory coffee, which will jack up your blood pressure if you have high blood pressure. It will dry you out if you have dry skin. And, many people have even ended up with ulcerative colitis from having years of coffee on an empty stomach in the morning. So I would just do the green tea. So there's all variations. And now could be some people with red and hot and burning with pussy heat, but it has to be diagnosed individually. That's why these classes are quite tricky. And I know people are looking for quick and easy cures. And Ayurveda is very sophisticated, very detailed, and very individualized. So I have to see the skin condition to diagnose it, because whatever the patient calls it, or sometimes some patients have come to me and they said that, oh, one doctor called it psoriasis, another doctor called it eczema, another doctor called it a type of allergic reaction. So, or even they are concluding, oh, it's a rare skin condition. Have you ever heard of it? It doesn't matter to me what the name is. I have to still diagnose it according to Ayurveda, because Ayurveda system is a comprehensive system. The diagnostic method is going to tell me the treatment. In fact, the whole trick is the diagnosis, not the treatment. I know many people, they just want to get to the treatment, tell me what to take and stop talking. But if you can't diagnose it right, the treatment won't be successful. And even with all my years of experience, sometimes, for example, in a skin condition, I'll give out herbs and they say, didn't work. So I said, oh, okay, I'm going to change the formula, no charge. And then it works. And then they say, well, why didn't you give me that the first time? I go, well, I'm not perfect. And it does happen, probably the volume of patients that I see, it's probably happening like once or twice a month, where, let's just say, I picked the wrong formula, but the wrong formula is picked because of the incorrect diagnosis, because it's very specific in Ayurveda. For example, you could have a pitta skin problem. You could have a pitta vata skin problem. You could have a pitta, vata, and kapha skin problem. And then the treatment needs to change and the diet accordingly. It doesn't matter what the dermatologist called it. So again, we're going to focus mostly on these. I'll show you some herbs and some products that can help you. But we're mostly focused today on these inflammatory, red, burning skin conditions. Even eczema with red and heat and burning, inflamed eczema, we could call it, or psoriasis, and rosacea and redness. This is where we're going to focus today, because acne is more with pimples and whiteheads, is more of a kapha condition, and little blackheads and little dots without the red is more of a vata condition. See, so this is the way. And then, of course, every individual, they're generally creating the problem through the wrong foods and often poor digestion and poor elimination. So you always have to change the diet with any skin condition. You always have to give something for the digestion. And you should, almost 9 out of 10, I'm giving something for the elimination as well. So, it's not just, oh, take this one herb and you're done. Even here, I'm going to show you what I give a patient for, say, rosacea, inflammatory skin condition, and psoriasis. You'll see I use more than one product for the skin condition, something internal, something external, and sometimes even some liver herbs. Now, I didn't mention that, but most cases we need to treat the liver too, particularly for psoriasis, and again, we have many liver formulas, but if there's heat and burning, then, there's often a liver herb. And I didn't mention it, but we also have like allergic skin conditions where it's itchy, rashy, and it's not chronic, always in the same spot. It's just, every time you eat something, you get this rash or these hives. Or in my case, if I wear a watch, it starts itching around where the watch is. Or if I wear clothes that is not cotton, I can be itchy. So I've taken my allergy skin formula before. And allergy skin formula is usually used for somebody who has kind of allergies. And I did have respiratory allergies as a child, and I'm still a little bit susceptible to them with cats and pets. So I have this tendency for an allergy because my immune system is very strong. I never get sick. I never get colds. Thank God for that. But my immune system is so overactive at times that, it over responds, very sensitive to the clothing. And that's why I don't wear a watch, because it starts itching around my wrists. So there's also allergic skin conditions, but these can progress and become more inflammatory. So the allergic skin conditions is another category. Okay. And we have different formulas, but let me show you some of these different formulas and products, internal and external products. So if you have one of these skin conditions, you can take note and you can pick this product on your own. The trick will be the diet and other causes. Otherwise, you could do an appointment with me. But let's take a look here. Skin-related testimonials. I always like to read what I wrote here. Like other tissue of the body, the skin can be congested, which will be dry without sweat, a lot of itching, and inflamed with infections, redness, and burning, or depleted, nutritional dehydration and low fat. And in fact, a lot of skin conditions can also improve with vitamin E, B complex, niacin, omega-3s. So nutritional supplementation can help in many skin conditions. That's a separate diagnosis, but nutritional deficiency definitely can lead to certain skin conditions. The health of a person can be seen through the condition of the skin, particularly the liver, and we can clearly see the results of liver toxicity, nutritional depletion, and inflammation, and even hormonal imbalances and quality of sleep reflected in the skin. We didn't even mention hormonal imbalances. Now, of course, as you're a woman and you tell me, hey, I only get this pimples right before my menses cycle, then we know it's hormonal. Again, another subject. Then we would maybe give herbs for the skin plus hormonal balancing herbs. Thus, effective treatment of all skin conditions, including eczema and psoriasis, varies greatly with each individual and the causes. You're causing it. You're not inheriting it. You're causing it just unknowingly. I address the root causes of a skin condition, be it inflammation, dietary, or hormones. And removing this cause, adjusting the diet, and providing internal and external herbs, we can achieve great results. I think it's a nice summary. We can see some of the people thanking me. It's good to have great skin again. This guy, my face was baby skin clear in 2 months. Now, this guy was actually a very severe case. It was revealed and left after an accident. He had some accident. It was revealed and left with severe neurological damage, scarring on the face. The doctors said even with extensive multiple plastic surgeries, I would be horribly scarred for life. Yeah, it was pretty bad. He had a really red, inflamed skin condition. I guess he had some surgeries there after, I forgot the details. Doctors gave him some pills, did nothing. Um, then he met me, and he's still taking these herbs every once in a while, and he thinks it's a miracle. Well, it's really Ayurveda. The red spots are fading. Um, and after 7 days, following my formulas, face is normal. The results can be very fast. You can see the results. It's not like losing weight. It's going to take 6 months. It just, they get results quite quick, but they often have to keep going for a while to, clear the skin, clear the blood. 4 days, completely clear. This person had autoimmune condition, psoriasis. She battled it for 30 years. Um, and I took care of it. Better. Itching's pretty much gone. You'd have to go read the details here, but we got plenty. So sleeping better, plenty of testimonials here. So let's go look at some of these products. If you go to our sponsor's site, Herbalist Teas, of which I'm the sponsor, and you go to health conditions, and then you go to skin conditions, then you can see all of the skin condition products. These are all of the different skin condition products. So there are many. I'm just going to show you some that relate to what we're talking about today. Now, this is a liver ghee. And you can see it right there. There's a picture of it. And this is an Ayurvedic ghee we import from India. And this is it's good for dry skin conditions. It really helps with almost all skin conditions. I think I even say that, good for almost all skin conditions, particularly eczema. It detoxifies the liver, purifies the blood. And you only need to take about a half a teaspoon of it a day. And you can see one of the first ingredients is neem. So you're going to see a lot more about neem when it comes to skin issues. So this is really a supplemental treatment. It's not the main treatment, but often I'll give this out, particularly if there's dryness. You just take a half a teaspoon once a day, and it really helps with itching. It helps very fast with itching and dryness. And then there's this tea, which is very popular, blood detox tea, again, for almost all skin conditions. Now, I do have two teas for skin, but this one is very good. I've done it a lot myself. And you can see one of the main ingredients is sarsaparilla root. Sarsaparilla root is very sweet and cooling and very well known to help with a skin condition. When I went to Jamaica, I brought back a lot. And it has herbs like dandelion, burdock root, and yellow dock that are known to be blood purifiers. So this is very effective. But there's another one, this one here, skin healing tea. And this is more for like acne, pimples, aging, and improved complexion. Really not in the same category we're talking about today. But there's the sarsaparilla root. There's the dandelion root. There's the neem. So you can see there is, this is more for your overall complexion and pimples. Now, if we get to the specific formulas, the Ayurvedic formulas, they're more powerful than the teas. You always have to keep in mind the teas are weak decoction. And they're just, Western herbalism is just not as sophisticated. We don't have as many extra pre-made formulas like we do with Ayurveda. But here we use, this one's for acne, rashes, and eczema without the red inflammation. But you can see again, there's the neem. Now, Haridakand is a formula in Ayurveda. It's made of 8 herbs, and Harida means turmeric. This is one of the few, and it's basically, this is very much, Haridakand is used for allergies, skin allergies, and rashes, not so much for psoriasis. And Manjista is probably the premier herb for the skin. So you're going to see all of these formulas have Manjista. Now, here we go. Here's the one I really wanted to show you. Well, I've got 2 versions of it. This one here. This is for inflammatory skin conditions like psoriasis and mild psoriasis and rosacea, where there's redness. For itchy, dry, red skin conditions, especially heat rash, rosacea, and mild psoriasis. This is for, I give this out all the time for rosacea. It just takes care of it real fast. And you can see first herb Manjista, and then sandalwood, which is cooling, Shatavari, which is one of the most cooling, sweet nurturing herbs. And then Anantamul, and actually Anantamul is the same as sarsaparilla root. That's just the Sanskrit name because it's Indian formula. And there's the neem. Neem is very good for the skin. Neem oil, neem soaps, I mean, are all helpful for almost all skin conditions. So neem is a really beneficial, particularly the neem soaps. There's many on the market. I don't make my own soaps yet, but I'm sure by the end of the year I will have my soap line. But this one is I use a lot, particularly for rosacea and mild psoriasis where there's redness. Now, if it's really bad, I think I got some pictures here somewhere. No, I think I have pictures of bad. This one is for more burning red skin conditions, like more advanced rosacea and advanced psoriasis, where there's really burning and heat. And that's the main criteria. See, so if I see the redness and it's just red and pink and it's not really burning and inflamed, then I'll give this skin formula, the first one I mentioned, skin formula pitta mild. But if it's burning with heat, then I give this one the plus. So I got the same name, Ayurvedic skin formula pitta. There's just the mild and the plus, So the difference is the plus, you have the burning and the heat. And there we have some advanced herbs there. This is Kamadudaras, which is made of 6 herbs, and this has the basmas in it. So this is a very expensive formula. You can see the price is higher on this one than the other one. But this really brings down the heat and the burning in the whole body. See, it says right here, cools the body, reduces inflammation, helps rejuvenate the skin, detoxifies the blood. You're going to see all of these herbs are detoxifying the blood. And neem is fighting infection, purifying the blood, detoxing the blood, and it's also cooling. Here we can see for this one, its benefits. It's going through all the herbs on the website and how to take it. Now, we have another great product here, which really could give to almost all these skin conditions. This is the bath powder. I make a few bath powders, and they're really effective, particularly for babies. I've treated multiple babies now with just using the bath powder and with great results. And it's very soothing, and you can see some of the same herbs are in there. The neem, the mangista, and the nantamul, which is the sarsaparilla root, just another name. And then slippery elm, because that's coating the skin. So does a nantamul. It also has kind of got a slimy aspect to it that kind of coats and soothes the skin. That's why we call it soothing bath powder. And then rose petal powder. Rose petals are very cooling, anti-inflammatory, and work great in a bath. This has been really effective. I think I only made this last year for some babies, and it's just really proved to be a champ for allergies, all types. Oh, there's a picture, little AI picture I made of somebody in the bathtub because it does come out red. I've used it before. It takes care of itching like immediately. Hydrates, moisturizes, promotes skin healing, helps fight infection, purifies the skin. Just incredible, these bath powders. And I do have a few of them. This is the one that I'm showing you today is for more red, dry. There's other ones for maybe like fungal infections where there's more antiviral herbs in it. So that's, if you look at my package, for example, I have an inflamed skin package for psoriasis. Most inflamed skins. And there I'm using that bath powder. I'm using that mild pitta skin. And then I'm using my skin ointment right there. I have some ointments, which I didn't really speak about. But if we see here, we've got, there it is. See, so I've made these ointments. And what I've done is I've taken Ayurvedic oils, which I've used for inflammatory skin conditions, and I just added some shea butter and a little vitamin E to make it kind of into a ointment or a little paste. You can see a picture of it there. And it's still based on an Ayurvedic oil. We can see the name of the oil, Ayurveda oil, and Ayurveda oil is used for psoriasis. And but the oil is a little inconvenient. People complained about it. It's a little sticky, hard to use. It drips. So I added some shea butter and vitamin E. Shea butter makes it a little thick and kind of coats the skin real nice. Vitamin E also helps the skin heal and kind of preserves it. So I've turned some of my Ayurvedic oils into these ointments, and this is one. I have a few of them. You can see these on the website. That one is for. Then there's one for dry skin. It's using another Ayurveda oil. It was shea butter, a little coconut oil, and some vitamin E in that one. And this one is for very dry, flaky skin. Oh, here's the pictures. See, that's what this one is for. See, there's not a lot of redness. It's really dry. It's really deeply hydrating with the shea butter and the coconut oil, and helps. And these oils already known to solve this type of skin problem. We can go see the other one here. There we go. There's the example. These are the type of skin problems I'm mostly talking about today. These are red, inflammatory, burning. See, when you see that red, that's pitta. And then you touch it, it's heat, it's burning. That's where I'm really been focusing on. And this ointment here that I make, that's helping with dandruff and different types of dermatitis, psoriasis, even allergic dermatitis, and it really works very effective. So that's how, I have this inflammatory skin package, because people just tend to buy one product. But when I do appointment, I give you all three. I give you the skin formula, either the mild or the plus, the bath, and the ointment all together. So I've just made these packages and give you pictures of what they're good for. So that is the type of treatment we're talking about. So what I think is important here is that you realize that these skin conditions are more as advanced and chronic and stubborn as you may feel, are perfectly treatable. And I will say skin conditions are very stubborn. Like, you can start taking the herbs, the colon herbs, the digestive herbs, the ointment, the bath, the skin formula, and it can get better quickly. Like, you can see within days, as you saw from the testimonial. But if you stop it too early, it just keeps coming back. So I always tell people you have to go like at least a couple months, and maybe you still will have to take the herbs every once in a while, because skin conditions are stubborn, is what they say in Ayurveda. And that's because the toxins are still there and it takes time to get them out. And really, with this skin package, I probably could have thrown in the blood detox tea too. I probably should have included that in that package. I will generally do that. One tea, one ointment, skin bath, one internal. So I'll give you like 4 products for your skin problem. And that's one way I'm able to get rid of it so fast. And that probably is leaving you with over 100 herbs you're taking simultaneously to get rid of one skin problem. But this is what we call advanced herbalism. You're not just drinking burdock tea, for example. Well, I hope that helped you. And of course, if you want me to help you with your skin condition, please feel free to contact my office and make an appointment and fill out the appropriate paperwork. And we can do an appointment on Zoom, and I'll diagnose your skin condition, advise you about your diet, and send you the proper herbal products. Thank you very much, ladies and gentlemen. I wish you the best of health, happiness, and good skin.